Class on functional medicine. So I'm going to start out by saying this. If you look at my practice, I practice chiropractic, which deals with all the things regarding the nervous system, the nervous system's connection to the organs, a lot of neurospinal pain. And then we have functional medicine. Functional medicine is different in the sense that chiropractic cannot fix everything. There's certain things that chiropractic is not going to correct. Come on in, Carol. Good to see you.
Sorry.
It's okay. Hey, good to see you, Max.
As well.
Yeah. So tonight we're going to talk about the functional medicine part of my practice. And as you can see here, this is a tree that shows names of diseases like fibromyalgia, arthritis, diabetes, cancer. And then we have root causes underneath, like blood sugar dysfunction, dysbiosis, all the things we're going to talk about tonight. And so if you look at current health statistics in the United States, this is out of the New England Journal of Medicine in 2012. The U.S. spends more on health care than the next 10 countries combined. We have less than 5% of the world's population. We take 50% of the world's drugs, 80% of the world's painkillers. Now, you can't tell me that people here are in more pain than people anywhere else. You know, we take 80% of the world's painkillers. According to the World Health Organization, the U.S. spends a higher proportion of its gross domestic product on health, but ranks 37th among 191 countries in the effectiveness of our healthcare systems. So what's wrong with this picture? Okay. The third leading cause of death in the United States is the effects of properly prescribed pharmaceuticals and hospital errors. Now, I'm not saying that I'm not here to say that, but I'm saying that this is a statistic that's easily available. You can look up, okay? It's been published in journals. Our healthcare system does some things really, really well, and I think you probably admit that. Trauma care. We do that really well in this country. Acute serious infections, we do that pretty well, okay? But even the world's leading medical journals have stated that we need some change. It says, although the United States pays more for medical care than any other country, problems abound in our healthcare system. Again, this is out of the New England Journal of Medicine, September 6, 2012. We have unsustainable costs, poor outcomes, frequent medical errors, poor patient satisfaction, and worsening health disparities, which point to a need for change. So, unfortunately, many modifiable risks for chronic disease are not being addressed. So the problem is, it's not the trauma issues that we have, it's the chronic disease issues that are not being addressed properly. And so the New England Journal of Medicine says a preventative model focused on forestalling the development of disease before the symptoms or life-threatening events occur is really the solution. Now, let me ask you this. Would you guys agree with that?
No.
You wouldn't agree with that. Why not?
Stalling?
You don't think we should prevent disease?
Oh, yeah. That's why we have vaccinations.
Okay. Well, vaccinations, and I won't get into that topic tonight, but they aren't exactly stopping COVID.
No.
They're not doing that, okay? And so some vaccinations do prevent disease, so you're right about that. They do. Some childhood vaccinations do prevent things like mumps, measles, and rubella.
Yeah,
chickenpox. Chickenpox, right.
Yeah.
But the fact is there's a lot of chronic problems they're not being prevented, that are being treated when we see them. And the thing is, can we prevent chronic disease? And that's what the New England Journal of Medicine is asking. So it says, again, our current system does very well with trauma care. If you have a heart attack or a serious accident, our system works well. I mean, we can get an ambulance out there, we can get you to the hospital, we can save your life. But these strategies don't help things like fibromyalgia, type 2 diabetes, chronic fatigue, or arthritis. They don't address those problems. So that's where we get functional medicine. So functional medicine is a medical approach that focuses on identifying the actual causes of disease. So let me ask you this. Do you think that disease has a cause? That diseases have causes?
Yeah.
Okay.
Yeah.
You do. Everybody would agree with that. So if that's the case, does it make sense to focus on trying to find the cause of disease? I mean, it does to me. That makes a lot of sense to me.
The logical approach.
Yeah, it seems like it. So we want to find the origins of disease. So functional medicine, hey, come on in. Functional medicine practitioners ask two basic questions. Is there something in the body that shouldn't be there? Like parasites, hidden bacterial or fungal infections, toxic chemicals, heavy metal toxicity, toxic fatty acids. By the way, where do we get toxic fatty acids from?
Processed food.
Yeah, processed food, fast food, French fries, Arby's, okay? Structural imbalances, medication side effects, food intolerance such as gluten, dairy, or soy, or toxic emotions such as anger, greed, resentment, and unforgiveness. Do you think these emotions could contribute to disease? Absolutely they could, yeah.
Definitely.
Unforgiveness, are you kidding? Yeah. So where would we get like toxic chemicals from? Where are some of the places that we can get those from?
Insecticides, herbicides.
Insecticides, herbicides. What, can you give me a class of an herbicide that everybody knows about that's toxic that we're all exposed to?
Glyphosate.
Yeah.
Glyphosate.
Roundup. Okay.
Roundup.
Roundup. Yeah. Glyphosate. What other chemicals toxic chemicals are we exposed to? Anybody in here ever hear of plastic? Okay, so bisphenol A, bisphenol F, bisphenol S. Pardon?
BPA.
BPA. Yeah. BPA, bisphenol A. Right. So, what's toxic about the bisphenols, by the way? What is it? What do they do in the body? Anybody remember from some of my other talks?
Not sure.
They estrogenize the body. They act like estrogen. Very, very powerful estrogenic effect in the body. Okay? So, anybody in here ever hear of medication side effects? Okay. I have a whole talk on over-the-counter medication side effects that I do once a year. So this is here, is there something in the body that shouldn't be there? But maybe the body has something that it needs that it's not getting, okay? So trace minerals, phytonutrients, digestive enzymes, probiotics, exercise, diversity of gut flora, or positive relationships. I actually had a patient come into me one time, this is years and years ago. She got her blood work done. Her blood work was pretty good, and I talked to her for a while, and I just told her, right, I said, your problem is you just need some friends. She just needed relationships. She needed friends. More than anything that I had to offer her, she needed friends. And I think that's the thing that probably would have helped her more than anything. So our body needs things to function, okay? So let's take a mineral. If you're lacking magnesium, what can happen? Cramping, yeah. Yeah, you get cramps from magnesium. Yeah, like cramps. Here's a harder one. You'd have to been to one of my talks for this one. What about ionizable calcium? I'm not talking about just calcium, ionizable calcium.
Something to do with your heart? Nope.
Okay, that's a good try. Really good try. Yeah. I mean, our heart needs calcium to function.
Bones.
Okay, ionizable calcium is important. It's crucial for the immune system. Your white blood cells use ionizable calcium to kill viruses and bacteria. And in one of my talks on COVID called Nutritional Arrows to Defeat COVID, I showed a lot of research. It shows that people that are low in ionizable calcium tend to be more susceptible to getting COVID. There's really good research on that. You never hear that on the news, but the papers are out there. So, are the issues that we face in civilization, the health issues, pharmaceutical deficiencies? Like, if you get sick, do you have a pharmaceutical deficiency? For example, 1 in 10 people in America take an antidepressant. So is our population born with a Prozac or Wellbutrin deficiency? No, it's not. Okay, I'm not saying nobody should ever take these drugs, but we're not born with these pharmaceutical deficiencies. All right. So how would a functional medicine practitioner evaluate chronic depression? So the question is, what's causing the brain to malfunction? Is it trapped emotions? Food intolerance or gut flora imbalances can contribute to that because there's this gut-brain connection. Heavy metals or other toxicity, lack of sleep, poor cardiac function, fatty acid imbalances, blood sugar issues have a profound effect on brain function. In fact, if you see my Alzheimer's talk, Alzheimer's is labeled by some people as type 3 diabetes. Okay? How do fatty acid imbalances affect depression? Anybody?
Cause you to gain weight.
Well, our brain is made of fat.
Our brain's fat. Brain's made of fat. And if it doesn't have the right fat, you can't function right. So, if you're eating a diet high in omega-6 fatty acids or in fatty acids that are tampered by man, hydrogenated fats, which are one molecule away from plastic, they get into the brain, and your brain won't function right. There's a study done in prisons where they took violent prisoners and they gave them omega-3 supplements, and the amount of violence went down, okay? Because their brains weren't working right. All right, so there are very specific things that can cause depression. Now, one of the most common drugs prescribed in the country is statin drugs. 30 million Americans take them. Not only do they lower cholesterol, but they prevent the biosynthesis of compounds such as vitamin D, CoQ10, and sex hormones. So here's a typical side effect of statin drugs: muscle joint pain. So when people come into me and they're taking a statin and they have joint pain, I tell them, it could be your statin drug that's causing it. Now, some people have a hard time believing me when I tell them that, but it's true. Memory loss, lack of energy, loss of sex drive, low testosterone, diabetes, has an increased overall death rate. Those are the side effects of statin drugs. So if we want to lower somebody's cholesterol, do you think there might be better ways to lower it than putting somebody on a statin? Yeah, there are lots of better ways. Okay, they just aren't very profitable for the pharmaceutical industry. So let's talk about gut issues. So if you had acid reflux or heartburn or bloating, which I see a lot in my office, most physicians out there would prescribe Prilosec, Prevacid, or Acifex. These drugs will work for that. Okay, they'll help that. I know they will. The problem is you don't have a Prilosec deficiency causing heartburn. So what would the cause of that be? Well, it could be low stomach acid, deficient pancreatic enzymes, food intolerances, H. pylori infection, leaky gut, gallbladder. I've seen all of these. Hiatal hernia. Maybe you're just drinking too much soda. Maybe you need to cut back the amount of pop you're drinking. So we want to check some of these things and find out what might be causing the issue. So if you look at, again, this is one of those, if you look at diseases, here's the tip of the iceberg. It's the name of the disease. It doesn't matter what you call it: obesity, autoimmune, heart disease, fibromyalgia. You go beyond that, beneath that, and look at the causes. Then you're looking at mitochondrial dysfunction, detoxification imbalances, hormonal imbalances, chemical exposure. Those are the underlying causes of a lot of what's going on up here. So, by the way, let me ask you a question. What is the number one nutritional cause of cancer?
Sugar.
Sugar feeds cancer. Okay? The number one nutritional cause. And like I tell my patients that I do blood tests on, I look at the fasting insulin, and that number for me is a proxy for how much you might get cancer. Like, what are your risks for cancer? And the more that insulin level goes up, the higher your risks are for cancer. Okay? Because we know when insulin is high, sugar is high, and it's staying high. So we want to get the insulin levels down. Sir William Osler, some of you guys may not have heard of him. He's one of the founders of Johns Hopkins Hospital, and he's the originator of the medical residency program. Really smart guy. Okay, he said this. He said, the good physician treats the disease, the great physician treats the patient who has the disease. Okay, it's more important to know what sort of patient has the disease than what sort of disease has the patient. Okay, that's functional medicine talk right there. He also said, if you listen carefully to the patient, they will tell you the diagnosis. A lot of truth in that. A lot of truth in that. So I'm going to talk about 3 case studies that I've had in functional medicine. This is a 40-year-old female that came into me. Here's her symptoms: daily stomach pain, which is getting more frequent, alternating constipation, diarrhea, stomach pain so bad that she's had to lay in bed most of the days, many days. And she had 4 or 6 kids. You can't do that when you have all those kids. Past gallbladder removal, and she had mild anxiety and depression. She'd been on Prilosec for 10 years, okay? So that was not fixing this. It was managing it, but it wasn't fixing it. So what I found a hiatal hernia, ileocecal valve dysfunction, low stomach acid, low pancreatic enzyme. So I fixed her hiatal hernia. I gave her bile salts to help fix what the gallbladder wasn't able to do because she didn't have one. I gave her some stomach acid supplements, some supplements to help her stomach produce more acid, and some bitter herbs to stimulate digestion. Okay, results. Her stomach pain is much better. It pretty much resolved. She had more energy. She didn't know what didn't need to lay in bed anymore because of the pain, and she had more normal bowel movements. Okay, so that's a subject I hear a lot about in my office. How many people know that it's normal bowel movements are important? Okay, if you have your plumbing system back up for a week, what kind of life is that going to be in your house? Okay, well, that's backing up in your body like that. Your body isn't going to react any better. You're going to have problems. Okay, so here's another one that came in to see me. 71-year-old female, chronic fatigue, fibromyalgia, anxiety, depression, suicidal thoughts, poor digestion, constipation, poor memory. So what I found with her, I did some pretty in-depth testing on her. She had multiple food intolerances, low B vitamins, especially inositol, poor conversion, her thyroid wasn't working, fatty acid imbalances. She had very, very pronounced fatty acid imbalances, low vitamin K, low vitamin D. So this was her past illnesses. She had appendix out, thyroid cancer, failed low back surgery, which was one of her big issues, bipolar disorder, multiple auto accidents, abusive family relationships. She was on some pretty powerful pharmaceuticals. And what I did was I corrected her nutritional deficiencies. She stopped eating the foods that she was intolerant to. I gave her Brazil nuts to increase selenium, very low force chiropractic care to alleviate low back pain. The suicidal thoughts went away in about 3 to 4 weeks. Depression improved, back pain improved, and she was able to decrease her medications. And in her case, she couldn't get off all of her meds. She couldn't do it, but she was able to really decrease them. So here's the last one. This is a 13-year-old female, and she contracted mono 12 months before she came to see me, and then the flu over the following Christmas. So she was seeing me like late winter. She developed the following symptoms, caused her to drop out of the second semester of 7th grade, okay? Daily migraines, persistent vomiting, chronic fatigue, daily moderate abdominal pain. She couldn't even be in class like this.
Right.
So what I did, her mother, when her mother brought her in to see me, her mother had just gone through a very bad divorce, and I mean, she had her issues, and there was financial issues, and all kinds of things going on. So I didn't do as much testing as I would have liked to have on her, but she had autonomic nervous system imbalance, she had food intolerance, and she had adrenal fatigue. So what I did with her, I adjusted her, I took her off her food intolerances and desensitized her to some of those ones that she was intolerant to. I gave her specific nutritional supplement formulas to heal her GI tract and her adrenal glands. And so her migraines got better. Stomach pain and vomiting were gone. Energy came back. She was able to go back to school and finish the 7th grade. And she was able to go on an overseas mission trip the following summer. Now this was a while ago. She's in college now and doing well, you know. So she really got over these issues and is doing quite well. Now the reason I have her up there is because her mother was going to take her to Mayo Clinic. I was her last stop before Mayo Clinic, and we were able to help her. And the thing is, when kids get sick, they can be helped, you know. Sick kids, chronically ill kids can be helped, and they don't always need all kinds of drugs. You can adjust them, you can give them some supplements, and a lot of times they get better, and they don't have to have all these organs taken out and all the other things that some people do. And this is a good example of that. And she's fine now. She's thriving. Any questions on anything I went over? I'm going to give you one other case study. I didn't have time today to put it in here, but I wanted to do it. This woman came to me in 2020. She came to me and she was all puffy and just full of hives. And like, can't remember how she heard about me, but in her mind, and she's 26 years old, that's pretty young, you know. To me, that's like a baby anymore, but she thought her life was over, basically. You know, she came to me, but her life, as far as she was concerned, was over because she had gone to several different kinds of doctors, hadn't been able to get over this, and so I did what I normally do, wrote her up a functional medicine report, and we did blood work on her, and we did food intolerance testing, and she was intolerant to a whole bunch of the stuff she was eating, wheat intolerances, dairy, and she had some very, very pronounced metabolic deficiency. She wasn't, digesting her food at all. She had vitamin D deficiency and some other things, and so we took her off all her food intolerance, all the food she's intolerant to, and I gave her nutrition to help with the deficiencies, and she came back a month later and she'd lost 15 pounds. She looked totally different. All of her hives were gone, completely gone. They never came back, and she had some other issues I was able to help her with, but she got well, and I mean, her hives were gone within a month, 30 days, gone. And so sometimes people get well fast, but sometimes it doesn't always work like that. Sometimes it takes time for people to get better. You know, it seems like the older people are, the longer they've had a problem, the longer it's going to take to get them better. Kids get better, younger people tend to get better a lot faster. So, any questions about functional medicine? Okay, well, good. And some of you in here are functional medicine patients of mine. So, good. We got done a little early, 5 minutes early. So I'm going to let you go. Thank you so much for coming tonight and for taking a half an hour out of your life to try and understand, how our bodies break down and what we can do to build them back up again. And next time I talk, what are you pointing to?
The schedule.
Schedule.
Because
Okay.
I don't have it up there on the board yet.
Okay, so the next talk that I'm going to do is on November 9th, and that's how not to short circuit your brain. So if you want to learn more about that, come to that talk. I have about 4 talks on the brain, and that's one of them. So that's going to be a good one. Okay? Any other questions? No questions. Okay.